Good morning, everyone. As Mike said, I'm Dave Battinelli. I have the privilege of serving as the physician-in-chief at Northwell Health and the dean at the Zucker School of Medicine at Hofstra, Northwell. And it's a pleasure to be here. And as always, Mike, thanks for the kind words. So thanks really for joining us here for the Age Revolution Summit. As Mike mentioned, the demographic shift that has brought us all here together today, it's not just about the challenges of delivering healthcare, but rather the responsibility to society that we as the leaders from across the healthcare continuum have, and that is why we must join together and in fact define the future we want to provide for our aging demographic. It is about that future and the care that we owe our aging population and elders. We're here today as the leaders who live this dilemma every day and have devoted entire careers to providing a vision to help redirect our society and healthcare system to partner and realize that vision. My very first job after training as an internist in 1986, in fact, was as a geriatrician, although we didn't call, actually I was geriatricians at the time. I was at the Boston City Hospital working on a research study on an inpatient unit to help preserve independent living for a frail population. It was difficult. I can tell you 40 years ago, many of the issues faced then remain the exact same challenges of today. And while there is much that we should celebrate regarding the advances in healthcare and longevity, there remains even more opportunity to improve the disparities that exist, not only in the traditionally considered disadvantaged populations, but equally or perhaps more so for an aging population seemingly hiding in plain sight. That said, I am personally remaining incredibly optimistic and excited that emerging and future discoveries and advances in technology and science will conquer some of these challenges with the right leadership. Events such as this summit are critical to bringing together thought leaders and collaborators to transform and reshape the narrative and the solutions. Thank you all again for joining us here today and partnering as we begin this journey to an age-friendly future. As a note for the audience that is joining us here in person, following this morning's sessions, we'll be breaking into smaller groups for roundtable discussions where each of you will have the opportunity to dive in a little deeper into the topics being discussed on the stage today and more. So to start us off, we will frame our day by first answering why. Specifically, why is our society aging, and what are the driving forces as well as the catalysts behind the demographic shift and policies and initiatives to therapeutics and where we ought to be going.